Sean. Thanks, Sean. Okay, so slightly different change of pace and different topic. I'm looking more at sort of information and how we can share that with your audiences. So I kind of hesitate a little bit when I say audiences. Historically for us, it's been about patients, families and carers. But more recently, we're seeing a massive upturn in organisations using apps to be able to communicate and engage better with their colleagues. Right across the board. Just a little bit about me. Hello, my name is Chris. I've had a number of years in the digital media industry, spent 10 of those working directly for the NHS, managing their internet, intranet, online learning, and created a few apps along the way as well. Been around the block a little bit, worn the t-shirt, perhaps worn the t-shirt out, but I'm really, really interested in and passionate about, I guess, is the user experience, about that kind of making it easy for people. I think, as professionals, when we're providing information to our audiences, it's up to us to make it so simple that people don't have to think about it. I think the minute they have to start thinking about, what do I need to do here, or how does that work, or what's this fancy gadget or gizmo, they can potentially turn off and go and do something else, and we've kind of lost that opportunity. So the simpler the better, I think, in some instances with this sort of technology. Piota, been around for about four years now within the NHS areas. We've got about 120, 130 NHS and social care clients, right from the very top at NHS England and Improvement, Public Health Wales, through lots of different ICSs, cancer alliances, trusts, teams, and everybody else within that spectrum. We have a healthcare app platform. So all of our apps look the same. We're licensing you the technology, we're showing you how to use it, and we're supporting you through that period of time. But these are also a selection of different apps for different teams and different services. So we've got an app here for paediatric guidelines aimed at staff. This one's a child healthy weight app aimed at the community. This is an app for care homes in the West Midlands. This is a cancer support app. So as you can see, all of our apps look very similar. We customise those, work with the teams to understand their challenges, what they're trying to achieve, and then configure the app accordingly to work with them. So first thing I'm going to answer really is about making our working lives easier, and we keep coming across this term sort of digital exclusion, where if I'm a member of staff within a particular organisation and I'm clinical or I'm a domestic, I may not have access to a computer. I may not have the ability to search the intranet. I may not have the ability all the time to search through my emails to try and find information about the different things that are happening. So this word exclusion, where we don't necessarily have the same opportunities as our admin friends who sit behind a computer and can access that information. So we're seeing organisations wanting to respond to that. Obviously, they're wanting to ensure that everyone's up to speed with everything that's happening, that everyone's got sort of equal opportunities, and everyone's got the ability to kind of get involved. So we're seeing, again, more and more organisations turning to apps, because a lot of your colleagues now will have mobile phones. I think we're kind of well into that sort of nth degree where everyone's got phones these days, and I'm kind of using them for just about everything. Why wouldn't you? This first one is an example of an app that we've put together for a hospital in the Midlands, and this one is aimed specifically at facilities management. So your housekeepers, your ward cleaners, your security people which have just absolutely no access to the intranet. There may be some computers scattered around they can use, but a lot of the information is kind of cascaded down from team leaders down to the ground. Well, this particular organisation wants to be a little bit more proactive, especially during and after COVID, where it was important that these people on the front line had access to the information they needed in an easy sort of way to access it. So this is their app. Their logos, their branding, their tiles at the bottom, or there's a menu system. The first thing they need to do is register. So it takes their works email address, and then once they put that in there, it sort of sends a 6-digit code, and then they can actually log onto the system itself. This sort of dual factor authentication is something we're doing all the time. We're all kind of familiar with it. It just ensures the security of the data, the device, and that the user actually using the system itself. Once they're logged in, they can go into the different sections. All the information here is curated by the facilities management team the management team at the hospital. So it's all the information that they want to provide to their colleagues. As I say, we license the platform, we'll install it, we'll configure it, we'll get it up and running with you. But then once once you've launched, we take a step backwards, allow you just then to put your information onto the system. So on this particular app, lots of information. They've configured it actually so they can log on to Netty, which is their intranet directly. So a really good way of allowing people to access it, from their device where they want to and when they want to. And the workplace is not always the place to get this sort of information. It might be on the bus or the train going to and fro. It might be sat at home at the end of the day when you've had a chance to sort of release that pressure valve and start thinking about what did that person say or what did that person recommend. It's all accessible via their phones as and when they want to do it. They've got access to the training on the app itself, so a lot of the mandatory training they can go and access it remotely. It's all about putting it into one place, making it quick and easy for people so they can access this information wherever they want. It's much more dynamic, I think, in terms of being able to share information. This talks about staff benefits. So it's all the stuff that that they want to share, well-being, all the sort of communications, all the engagement, including them within the conversation, including them within the resources and events and different things that are happening. It's a multicultural organisation. So within the app itself, we've embedded Google Translate, and you can translate into over 100 different languages. So the written content within the app can be translated very, very quickly into different languages if English is not your first. They make connections out to ESR. So again, there's lots of various platforms and different data sources and different applications running out there. And again, we're just creating or signposting, telling you about what ESR is and what the benefits are about ESR, how to go and access it, and if you're struggling, who to go and speak to. Similarly with My ISS, that's another app that they've created specifically, I think, for ISS across the country. And with all sort of good mobile phone applications, you've got push notifications and alerts. So a quick and easy way of grabbing people's attention to alert them to some new information, that there's something new happening. There's a new session or a new clinic or a new event or a new whatever it might be. I think we last time we looked at evidence about 3.5 hours a day. Little glance at your phone, little glance here, little glance there, kind of all mounts up. So seeing that little red bubble next to one of your apps with a number on there with a notification, it's a great way of giving somebody a virtual tap on the shoulder to alert them to something new. Moving on a little bit further, again, making our lives easier. This is a project we did for the Dudley Group for their emergency department team, and with as people have already mentioned this morning, emergency departments are potentially one of the most busiest departments within the organisation. Big KPIs to sort of meet and hit, and the consultant there, as part of that process was looking about, well, where can we save time? How do we maximise the day and maximise the human resources that we've got within the team to ensure that we're hitting these KPIs. So having a little look around, it became apparent that people trying to get access to information was a bit tricky. Lots of computers within the ED team there, but all being used for clinical matters, so getting blood results, getting sort of X-rays, other sort of clinical bits of information. But for the locums and medical students and junior doctors that weren't sure about various bits and pieces, it could be a little bit of a struggle. So they were kind of suggesting that they can look around and people are leaving a bay with a patient and just saying nipping out for a couple of minutes, just need to get some information, I'll be right back, and tapping somebody on the shoulder. Do you mind if I use that computer? Do you mind if I log you out and log you in? And if you've been in the NHS for a little while, that sometimes can be a 4 or 5 minute process of waiting to log somebody else in. So you can get a policy or you can get a guideline, or just to remind yourself of something clinically. So the consultant there decided, I'm going to put everything onto an app. We've all got these phones in our pockets. It's going to be a lot quicker, a lot easier, a lot more practical. And again, I'll make my colleagues' lives easier. So this is their app, same principle as with Derby. You've got to log in first with your work's email address, and then once you're there, you can go through the different areas and pick up the policies and pick up the procedures almost instantly. You can do this bedside whilst having a chat with your patient, a couple of clicks, and you've got the policy, you've got the guideline, you can be going through it, you can just jog in your memory. So all the guidelines and policies were on there. Extra things like rotas were on there again. So, you know, this information, again, you need to be at work, you need to click onto the internet, you go onto the share drive, and, you know, your rotas were there. But this was all made available for those, you know, those colleagues, so they could access that from kind of wherever. Within the app itself, within the functionality, we've got a forms or surveys or feedback section, and the team here utilised that to create one of their forms, so handover sheets, annual leave request forms, locum booking forms, everything again you might need to log somebody out of the computer, to log them in, to go and find it on the intranet. Just super easy. You know, with a couple of clicks, I can be producing a handover sheet. The results are then fired over to an administrator who can then, you know, process those. And similarly with the other sort of request forms. So the forms, the surveys, the feedback, they're used right across the board in the majority of our apps. So whether it's in this instance where it's a staff app, you know, we're looking at operational information. In patient apps, if it's a, you know, a families and friends type scenario, we use them, or one of our clients uses them to do pre-clinic questionnaires. Again, you know, provide the app to the patient, families and carers beforehand, explain that we need to get these forms completed before you come into clinic, and this can be done electronically. The information can be gathered. The consultant can be, you know, reading these prior to clinic. It just makes the whole process a lot slicker, a lot quicker, a bit more dynamic. You can focus on the important stuff and not having to fill in forms manually, you know, while you sat in clinic. This one's got a directory, and again, all of our apps come with these directories, which can be configured in slightly different ways. This one's got every consultant, every specialist department, you know, your X-rays, your bloods, you know, your ambulances, whoever else, all in one sort of place. So you can scroll through, find the consultant, find the area, find the team, press the call button, it will call and take you through to that particular area. Again, just saving valuable seconds off the process. You know, ordinarily you need to go and hunt down the phone list, or, you know, log onto the internet and try and find it. It's there in your pocket. Within 2 clicks, you can be speaking to somebody. So just, you know, marginal gains here, isn't it? You know, I borrow the phrase off Sir David Brailsford, the cyclist, but, you know, save a little bit of time here, save a little bit of time there, all added together saves a lot of time. And that could be, you know, seeing 5 or 6 different more patients throughout the day. Just those little saves and those little keeps. He's gone a little bit further and put all the mandatory training onto here. I think, like most organisations, sometimes struggle being able to communicate what mandatory training looks like, and what do you need to do, and how do I do it, and how can I access it. And so again, just put all that information onto the app. People can access this wherever they need to. I don't think anybody wants to be, you know, not up to date with the mandatory training. I think sometimes just the challenge is understanding what I actually need to do and how do I do it. So again, if we can lay this out on a plate, they can access this wherever you are, you know, sat on your sofa, have an evening, weekend, whatever it might be, on the train to work. It just makes sense. You know, it's just making their lives easier. You're providing the information that they need on a regular basis in a quick and easy format, which they can then go and access. Just information about different colleges. So it's a one-stop shop. Everything they need can be held in one area. They've got this in their pocket, you know, constantly, and they can access it whenever they want. This last screen again is about alerts. So for different things that are happening, they can do a little blast out to everybody, let them know about different testing or downtimes or results, or, you know, whatever it might be. Super simple, dead easy to set up, dead easy to sort of configure, manage, and run. Bit of a no-brainer, really. The last example I'm going to show is about improving the sort of patient experience. So in these instances, what we're really wanting to do is try and, you know, empower your patients to have the information at their fingertips about the, you know, what's going to happen, what is the pathway, where can I get help. So again, it's the same sort of principle, really. It's just making it easy for people, having a one-stop shop where I can go to a trusted source from my clinicians that have thought about and curated and supplied this information directly to me. This one is for a hospital up in the north, Chester Royal Hospital, and it's for the Macmillan Information Support Centre. So historically, they've got a pod and they've got a rack of information leaflets which they'll give out, and we'll happily take them from you and say thank you. But, you know, when we actually need that information, we've probably filed them away somewhere. So what they're wanting to do really is just to bring all that information, put it into one place. And it's not just about patients in these scenarios, it's about families and carers as well, probably more importantly. So they're aware of what support's available. They're aware of the different networks, local networks and support authorities out there that can kind of, help through this journey, if you like. So again, same principle, we work with the team, try to understand what sorts of information they're wanting to provide to their audiences and help them share the benefit of our experience to be able to produce the information and to send it out or to make it available via the apps. So lots of great information on here on a variety of different subjects, all written or curated or deployed by the team within the Macmillan team. It's an administrator that kind of does this. I think a lot of the content originally is already written, it's already there in electronic format, so it's about getting that information onto the app in the first place and then just keeping it up to date, and it's super easy to use. You don't need any HTML skills, you don't need to be an IT or a comms person. The responsibility can stick with the team, and I think that's quite attractive for teams, that they've got the control where they can send information out as and when. Again, multicultural audience, so we can use Google Analytics to ensure people can read it in their native language. Contact directories, again, pressing a button will take you through to that appointment desk or take you through to that specialist. Don't have to think about it too much. I can just press a button and kind of off we go. So there's three sort of very, very different but sort of similar sort of apps in terms of the usage and their end users. How does it all work? Well, we've got two aspects to it. We've obviously got the app, which we work with you to configure, and then we've got this sort of cloud-based content management system that kind of runs behind the scenes. The administrators will have access to the content management system. We'll show you how to use it, but it is super simple. And once you're logged in, you create content and kind of send it out. It's that easy. There's a simple editor where you can add text, you can add links to different resources, whether they be web-based or phone numbers or PDF documents or Vimeo or YouTube videos. So kind of all that good stuff that you've got here, there and everywhere, just bringing it all into one place, putting it on the app, and just making it available. So, within sort of half an hour, 40 minutes, we can show people how to use the system. The toolkit is relatively simple. If people are using Word and PowerPoint, they're familiar with 70% of the tools already. So, the learning curve is very shallow from that perspective. What does the little process look like? Well, get in touch with us, let us know that you're interested. We can organise a Teams meeting and just show you other examples of apps that would be similar to what you guys are trying to achieve. We produce a free trial, so if you're convinced that this has got some mileage, we can create a trial that looks and feels like your organisation. It has some of your content in there, which can then be used as a vehicle for sort of conversations internally. I think it's a lot easier, if you're championing an app and you've got other folks to include within that conversation, to be able to have something, to be able to show how it works and be able to download it onto your device and be able to see some of your content and answering some or fixing some of the issues that you might be experiencing. So we're more than happy to put those trials together and work with you to be able to to demonstrate the flexibility and the power of the app within your organisation. But normally this process can take elapsed time, about 8 hours or something, I guess. Meeting here, create the trial, get some content in there, show it to your colleagues or others, and then sort of take it through the procurement process. And whilst it's not a race by any stretch of the imagination, I think the quickest we did was at the start of the pandemic. We worked with a chief nurse in the West Midlands. She came to us with an issue and a problem early doors, and by the end of the day, we delivered the app. It was being rolled out to the care home teams within the patch, and to keep them up to date with everything that was happening during the pandemic. So it all comes back to that quick and easy, isn't it? Really, that's kind of really at the heart of what we're doing. Is being able to provide information quickly and easily to your audiences, but similarly is quick and easy for your administrators to actually deploy the information and keep the information up to date. There's nothing overly complicated here at all. It's super simple. In terms of costs, I think we make it too salesy. It starts off at about £2,500 a year, £2,500 a year for one end of the scale, depending on the number of users, up to about £50,000 a year. That's my alarm, for the sort of top end of the scale. So it's not a huge amount of money for actually kind of what you're getting in terms of the app and the functionality, and more importantly the ability, I think, to to reach out to your audiences and make their lives a little bit easier, a little bit more comfortable, by providing them with information to do their day-to-day duties, whatever they may look like. I think that's me. I think I've had 20 minutes on the button, or just over 20 minutes, so happy to take any questions from anybody.
Thank you very much, Chris. Brilliant presentation as usual. The first question was based on, do you provide free trials? I feel like you've been very comprehensive on actually answering that within the slides. But you just want to recap, Chris, on the free trial, how people get involved, get in touch with you.
Get in contact with us, let us know that you're interested. We can have a Teams meeting. Tell me about what you're trying to do. I'll show you examples of how other organisations have done something similar. At the end of that, if you think this has got some some mileage within your organisation, we'll create your free trial. I'll put one together. We'll put your badge on there, your colours. We'll talk about the tiles, the labels, the logos. We'll get some of your content behind the scenes. So you've got then an app that you can take to your team and say, well, this is what I'm thinking. Let's download it. Do you like the look of this, or could this work for us? I think it's that seeing is believing, rather than just talking about pie in the sky. You've got something tangible that you can play with, that people can look at, and I think it just makes it moves that conversation on quite quickly. I think from experience, that's what we're trying to do. We're trying to make it easy for people, aren't we, right across the piece. So yeah, if people are interested, get in contact with us, and we'll happily create you a trial for you to be able to go and use within your organisation.
Perfect. I'll be hoping there's plenty of people looking to take advantage of that today. So, quick question again, following on to that really. Once the app is done, so someone was to go ahead and complete an app, who owns the rights to the app once it's built and provided and handed over, Chris?
We're always going to own the app. We're licensing you the platform to kind of use it. Any of the content within the app is obviously yours, and you own the intellectual property if that's the road that we're going down. But yeah, at the end of the license, we'll delete, and we've got process and procedures for ensuring all that content's gotten rid of. We can hand back any content that you want to use in other initiatives. But yeah, it's always going to be our platform. We haven't sold the platform, and I don't think we're also kind of the crown jewels of what we do, but we do sort of license the platform. But all the content is yours. Once you're kind of up and running, as I say, we'll take a step backwards really then, and then we're here to support you. We're there to provide updates, provide any new features that come throughout the development process, and just be there to call or email us if you've got a problem, query, or a question.
Love that. Perfect. Thank you very much, Chris. Last question here from Nazim, which is, what languages are the Piota apps based off? What languages do the app support?
We use Google Translate. So I think Google Translate have about another 120 different languages. I couldn't actually tell you each individual language, but it's the majority of the languages that are being used across the globe. I guess in there adding to the languages, as regular as they can do, sort of thing. But I think most of the clients that are using languages, no one's come back and said, can you do this and can you do that? So I'm assuming, I should never assume, I know, that most languages are taken care of.
Absolutely perfect. Well, Chris, always a pleasure, sir. Thank you very much. We'll get those slides shared after the conference, and as mentioned, please do make use of the free trial with Chris and the team, and have a little look at what apps you can create, and hopefully they're helpful. But yeah, cheers again, Chris.
Thank you very much.
Cheers again, Bill.
Okay.
Thanks, Chris. Bye-bye.